Good morning, everyone. We'll be starting in just a moment, so just hang tight. Welcome, everyone, to today's webinar. Let's talk about intimate partner violence, integrating culturally responsive approaches for survivors of domestic violence and intimate partner violence within mental health services and organizations, with our presenter, Tori Weinkoop Abrahamson. This webinar is co-sponsored by the Great Lakes MHTTC and SAMHSA. The Great Lakes ATTC, MHTTC, and PTTC are funded by SAMHSA under the following cooperative agreements. The opinions expressed in this webinar are the views of the speaker and do not reflect the official position of the Department of Health and Human Services and SAMHSA. The MHTTC network believes that words matter and uses affirming, respectful, and recovery-oriented language in all activities. For more upcoming events and information, please follow the Great Lakes MHTTC on social media or visit our website. A few housekeeping items. If you are having any technical issues, please individually message me, Jen Winslow, or Ann Shensky in the chat section at the bottom of your screen, and we will be happy to assist you. If you have any questions for the speaker, please put them in the Q&A section at the bottom of your screen rather than the chat. It helps us keep those questions organized, and we will do our best to get them answered. We will be using live transcription during the presentation, and at the end of the session, you will be automatically redirected to a very brief survey. Certificates of attendance will be sent out via email to all who attended the session in full. This can take up to 2 weeks. And if you are not seeing it, please make sure to check your spam or junk folders. The recording and presentation materials will be available within the next week on the Great Lakes MHTTC website. Now, this is our presenter, Tori Weinkoop Abrahamson, is a citizen of the Spokane tribe located in Eastern Washington State and the training and technical assistant manager at the National Center on Domestic Violence, Trauma, and Mental Health. She began her advocacy journey during her undergraduate career at Illinois College by establishing a sexual assault support group in response to the Me Too movement. After graduation, she returned home to the Spokane Indian Reservation and worked as a domestic violence advocate, providing assistance to survivors of domestic violence, sexual assault, teen dating violence, stalking, and elder abuse. Assistance for survivors often include accessing resources for civil and criminal court cases, mental health support, and substance use services. This position encouraged Tori to pursue and complete a Master of Social Work at the University of Chicago Crown Family School of Social Work, Policy, and Practice. Prior to joining NCDVTMH, Tori provided SAMHSA-funded training and technical assistance to tribal communities and nations with a focus on building program capacity and sustainability in the areas of suicide prevention, substance abuse, and mental health. Welcome, everybody, and thanks for being here.
Sorry, I had a difficult moment locating my mute button, but yeah, thank you so much for that introduction. I'm going to go ahead and share my screen and start my presentation. Okay. So as mentioned, my name is Tori Weinkoop and my pronouns are she, her, hers. And I'm just really excited to be here with all of you today. Before we get started, I just wanted to let everyone know that I'm going to have today's webinar try to be as interactive as possible. This just includes inputting your questions in the Q&A box. And we also have 3 activities that I'm going to have us participate in, where there are 3 activities where I give you the option of utilizing a QR scan code or a link that would be placed in the chat as we get closer to those activities. And this is more or less to help us engage with reflection questions, collaborate, and give us the opportunity to share our own thoughts within the format of the Padlets that I provided for today. There are also a couple of activities that does require like something to write with and a piece of paper. So please have these ready when we get to that time and the time allotted for those activities. And again, I will be answering questions throughout today's webinar. So feel free to input your questions into the Q&A chat box at any time. And the individuals that are here will help facilitate that by pausing me and reading the question out loud. So with that being said, the National Center on Domestic Violence is a special resource center that is dedicated to addressing the intersection of domestic violence, trauma, substance use, and mental health. We have 4 focus areas that include training and technical assistance, research and evaluation, policy and development analysis, and public awareness. And so I wanted to draw everyone's attention to the image that's on the right-hand side here. And this is the center's integrated approach that we use here. And there are 4 key principles that are here on the outside, which include the human rights and social justice approach, the cultural, historical, and community context, domestic violence and sexual violence advocacy, and a trauma-informed approach. And these 4 key principles are informed by the core principles that can be found in the middle of this image, which include survivor-defined approach, physical and emotional safety, hope and resilience, and relationship and connection. So for today's session, it will have an emphasis on the key principle of cultural, historical, and community context, and how the core principles or other frameworks that you work within can help inform us of cultural humility, cultural responsiveness, and equity-based approaches while working with survivors of domestic violence and intimate partner violence. Here are today's objectives. The first one is define culturally responsive services for domestic violence and intimate partner violence survivors in mental health settings. The second is to identify at least 2 examples of culturally responsive approaches to support survivors of domestic violence and intimate partner violence. So as I said in the beginning, I'm going to try and make this webinar as interactive as possible to help foster learning and collaboration around the topic of cultural responsiveness, and to help us get more comfortable in using the chat function and the Q&A function. For this, the chat function. I invite you all to put into the chat the following. The first, your name, pronouns, organization, and location. And the second, your favorite dish to eat. And I just want to note that I have seen participants already put into the chat, their name and organizations, and I think that's great. So now just place your favorite dish to eat. Yeah, I see we have individuals from, it's a wide audience today. That's great. Pizza is a very popular dish so far. Caramel rolls, sushi, tacos. I think my favorite is definitely pasta. think I eat pasta like every other day, which may or may not be a good thing. I don't know. But yeah, thank you to everyone who's sharing in the chat. That it's going so fast that I'm having difficulty keeping up right now. But it's great. I really enjoy that there's so many here today. Okay, thank you for your responses. So values, purpose, and vision. The accessible, culturally responsive, and trauma-informed approach that I just discussed in the previous slide with the core principles and the key principles integrates several components and approaches to help us guide in assisting survivors of domestic violence and interpersonal violence. And as we will see throughout this session, applying the values, purpose, and vision to engage with survivors through a cultural humility and equity-based approach is relational to our interpersonal and institutional self-awareness and reflection. By fostering self-awareness and reflection, we are better prepared to identify oppressive practices and overcome them to be better aligned with our values and intentions that fully support domestic violence and intimate partner violence survivors in their own unique journeys. I wanted to help further set up this conversation. I wanted to define domestic violence and intimate partner violence. So intimate partner violence is experience of stalking, physical, sexual, emotional, financial, cultural, and other forms of abuse by an intimate partner or ex-partner. And domestic violence is the experience of stalking, physical, sexual, emotional, financial, cultural, and other forms of abuse by an intimate partner, ex-partner, household member, family member, or other close social support. So why focus on culturally responsiveness, specifically for survivors of IPV and DV? Is it cultural responsiveness always important regardless of experiences of trauma? And the answer is yes. Culture informs, shapes, and influences everything. And cultural responsiveness is an important dimension of care for every person. And this becomes particularly important for survivors of intimate partner violence and domestic violence and other trauma because of the ways that culture and power dynamics are intertwined within our society and the organizations that we work in. So survivors are deeply aware of power dynamics because survival depends on this awareness. And so this particular aware of power dynamics that come up in provider relationships, let me rephrase that. So power dynamics that come up in provider relationships and within organizations should strive for culturally responsive and equity-based approaches as part of reducing the risk of re-traumatization and re-victimization when working with survivors of domestic violence and intimate partner violence. So defining cultural responsiveness in relation to provider organizations and survivor interactions is not going to be one size fits all. I mean, you can have a very generalized term, but that is a little difficult since each of us work in communities and environments that are different across the states and in particular the Great Lakes region. So therefore, to define cultural responsiveness is dependent on the population you are working with, the historical and community legacies of trauma. Again, how are power dynamics showing up and how it's pervasive in the context of domestic violence and intimate partner violence context, and how you are centering the voices of the survivors that you are working with. So since survivors are deeply aware of power dynamics and power imbalances, I want to give a couple examples of how this can show up in our practice and organizations. So when we are looking at dynamics that are power over, service providers and organizations tend to have punitive practices that can be controlling or dismissive of the survivor's experience, especially if the survivor's background is not rooted in Western culture. It's important throughout today's session that we're thinking about how we can move away from a power over dynamic into a power with. Power with allows survivors to determine their autonomy and the choices that are best for them. This means that service providers are collaborating with the survivor to identify resources, possibility of choices, and integrating a cultural responsive approach that fit the needs and wants of survivors at the forefront. So to put simply, the survivors are guiding this process. And so as I stated, I would like to give my own examples. And so my first example is a time that I felt a provider or institution had power over me. And this has more or less to do with the intake process and looking at when I was first engaging with these services, looking at their intake process, specifically about race and ethnicity. And within their race and ethnicity options, they did not have an option for Native American or American Indian. I had to check the box for other. So the cultural norms and expectations that were centered in this situation definitely were not mine or of my own cultural background that includes an Indigenous or Native American perspective. Perhaps they had other cultural responsive approaches that were integrated, but definitely not for my own community. And so that intersection with my positionality and cultural worldviews was essentially zero. It was difficult to have conversations that revolved around difference of opinions around mental health, suicide, domestic violence. And this power imbalance maintained because there was never questions about what my perspective may be. And if my perspective was brought up, perhaps that in a way it was implied that my perspective was wrong and that I needed to view it in this certain or particular way. And to have this partnership be strengthened, I think would have been very helpful to have more of an awareness of the populations that were within the community that they served, and perhaps how the cultural context that they were working within may differ or maybe completely opposite of the cultural context from my own background. So now I want to share a time that I felt a provider or institution had power with me. And again, this has to do with the intake process that I was introduced to, specifically for the ethnicity and race portion. And within their section about ethnicity and race, they included options not only for Native American, but it also included a list of the different tribes and nations that I may be affiliated with within that specific region. So my cultural norms and worldview were honored in this situation because not only did they have Native American, but they had a very thorough understanding that Native American cultures in general are not monolithic, and that each tribe has their own practices. And so this helped the power dynamics to be actively shared in a respectful partnership because I felt heard and respected and understood that I don't have a very strong Western context and that it's difficult to access services, especially from my own historical and collective trauma that I've experienced within my own community. And any gaps that were apparent within either the intake process or the sessions themselves, they were bridged by asking me questions and what my level of comfortability was engaging with certain practices, or if I had any suggestions that I thought might help with my own journey through mental health services. And I just want to note that my examples are based on services that were located outside of Native communities. And that's important because outside of Native communities, it's often very rare for me to interact with services that have a deep and thorough connection to the Native communities that surround the area. So reflecting back on domestic violence and trauma in a social context and power dynamics of power over and power with demonstrate that each of us have ways that we self-identify, connect to, and sustain ourselves and make connections to people that we trust. So in this image, we have the inner circle that represents the connection with self. And then we have the outer circle that represents our connections to trusted others. And then the arrows represent experiences that are disconnecting or disruptive to feeling safe, welcome, and part of a community. Historical and collective trauma and the ongoing legacies of oppression can prevent any of us from feeling safe at work and service settings. Experiences with trauma and domestic and sexual violence committed by people we love, trust, or need in our lives can be devastating. Disruption to a sense of belonging in our own communities contributes to the feelings of being othered and unsafe. And experiencing racism, sexism, heterosexism, ageism, and all other forms of oppression based on location, cultural identity, spirituality, country of origin, or immigration status can jeopardize the survivor's feelings of safety. So before I move forward, I just want to leave space to see if anyone has questions up to this point.
There are no questions in the chat so far. Just a reminder to put them in the Q&A. If I do see any in the chat though, I will make sure to let you know.
Awesome, thank you. So identity, belonging, and positionality. It's important to understand that we cannot determine identity for another person, so don't assume. What is important is unique to each individual, so it's important to ask. And anything we think we know about someone's identity, cultural priorities, or parenting style must be checked out with the person. It is truly a case of each of us being an expert in our own experiences and lives. It is also crucial to note that people may identify themselves differently depending on the setting and conversation, or have different priorities in the moment based on safety, connection, or perceived risk. As stated, cultural responsiveness is important to cultivate and foster in service settings because of the power imbalances that are inherently in place between you and the survivor. So not only do we need to understand the social context of domestic violence and intimate partner violence, we also need to understand as service providers how our own cultural values and positionality influence our engagement with survivors, and how it can either build or destroy trust in that working relationship. So all of us have unique life experiences. It is what shapes us, shapes our beliefs, our engagement with people and environments around us, and influences our perceptions of life. And the experiences we form throughout life also determines our sense of belonging within ourselves and community and society. So belonging is a good foundation to consider when thinking about identities. It can be as simple as, who or what do I belong to? What does it mean to belong? And do I belong to different groups, identities, communities? And if so, how many? So keeping these initial questions in mind about belonging, groups, and activity or identity, I want to start our first activity. So again, I asked everybody to have a pen and pencil ready and something they can write with. And I want us to start out by drawing this image that's on the screen right now. So drawing the circle and then drawing the lines on the left-hand side. So I'm going to go ahead and give you a few seconds or moments to do that. Okay, and for this activity, I want us to begin by paying attention to the lines that are on the left-hand side. So only pay attention to the lines on the left-hand side right now. And on the left-hand side, please fill out all the different ways you identify culturally, meaning writing down identities that you hold within yourself and the groups that you may belong to. It can be anything. It can be a word, it can be a phrase, just anything that shows how you identify and how it makes sense to you. So I will give you about 3 minutes to do this. And if there are any questions so far about the activity, please go ahead and put that. We are not focusing on the circle right now. We are only focusing on the lines on the left-hand side. So within those lines, you are writing down like a list of how you identify culturally or the groups that you feel like you may belong to. Thank you, Christina. That was very helpful. I'm gonna give you all about 1 more minute. Okay, so now that you've filled out the left-hand side within that line, those lines, like your list, I now want us to focus our attention on the circle and imagine the circle to be a pie. And within this pie, take the identities that you've written down and assign each identity slash group to a slice of pie. So the size of the slice depends on the importance of that group and or identity in your life. So if it's very important, you give it a larger slice of pie. And if it feels less important, you can give it a smaller slice of pie. And I encourage you to try and get all of your groups and identities into your pie. So I'll give you about 2 to 3 minutes to do this too. Okay, so hopefully that was enough time to fill out the pie for the circle. Now we are going to enter our first activity that includes a Padlet. So you either can access the Padlet by scanning this QR code right here, or you can access it by selecting the link that's in the chat that Anne placed for us. And when we get to the Padlet, let me go ahead and get myself in there. You will have these reflection questions listed in there. And I encourage you all to choose 1 to 2 questions that really speak to you the most and respond to those questions. And I will give us a few minutes to answer the questions, and then I'll do a quick reflection on maybe the sort of themes that I see within the responses. So if there are any questions about that, feel free to put it in the Q&A. And I do want to note that your responses are anonymous, so hopefully that gives you some comfort. Yeah. I'm seeing a lot of responses so far, specifically for number 2. Yeah, there are usually a lot of challenges with this activity. Oh no, you did, doing it on paper is perfectly okay. You didn't need to do it on this Padlet. The image of the cultural pie worksheet is to just help reference which activity we're on.
Tori, did you want me to share the Padlet in real time, or did you want to just keep it off the recording?
Yeah, we can share it in real time.
I can pop up, I can share my screen, click, and we'll show it in real time, and then you can hop back into your PowerPoint.
Yeah, thank you.
Mhm.
Okay, so for question 1, what was this activity like for you? I'm seeing that for many of you, it was really hard to come up with identities for yourself. It was uncomfortable. Others stated that it was helpful, and reflecting on who you are is always needed. One individual stated that this activity really helped me realize more about myself in terms of how I identify, along with seeing what identities I strongly resonate with. Yeah, some stated eye-opening and challenging. That is a great transition into question 2. So question 2, what challenges came up as you created your pie? Dividing the pie and labeling yourself. Deciding how big the pieces should be and how they're all intertwined with one another. Some of the areas I think of as more important to my identity don't match with the importance society places on them. Yes, that really I really resonate with that statement. Thank you, Clara, for it was powerful. Being authentic, how to weigh the different identities, and just in general, really dividing up that pie. Yeah. I would say that I've come across individuals who, when they've done this activity, don't label their pie, which is totally fine. That's completely okay to not label it. But that just demonstrates the level of challenges that can be to really sort of try and divide up, your own identities. I know for myself, I've done this activity so many times, and every time my pie looks different, and every time it seems like the way I assign based on my identities change. Like one day it's really important for me for this identity, and another day my slice of pie is bigger for this other identity, right? Yeah, hardest part is realizing that I have no identity that isn't tied to how others see me. Right. So that internal identification and how it's not being externally received. So as a Black woman, I feel like I do this constantly. So this exercise was a bit easier. I'm constantly aware of my cultural identity and how spaces impact my experience / treatment. Yeah, thank you for sharing that. That is definitely something else that I resonate to, because being a person of color, being within the BIPOC community, when I'm in spaces that don't center my cultural background or experiences, it just makes me so painfully aware of how invisible Native American culture can be for like mainstream services. So I'm going to go ahead and move into number 3, which is what strengths and resources are found in your pie. I am a helper, caretaker. I am a lot in different pieces, yes. The experiences and identity help me make me a great peer. Yeah, helper, strong faith, being a mother, a nurturer, understanding your upbringing and the importance of family. I apologize for my dogs in the background. They're very hyper right now. Yeah, it is interesting, Juana, and how we prioritize our lives, or how we compartmentalize it too. So number 4, what would happen if someone removed or ignored a piece of your pie? Yeah, not being yourself or feeling accepted. And it would be challenging and feeling like you're not seen. It gets very frustrating when someone does not realize how important a piece of my pie is. In quotations, you're 26, just do whatever you want. End quotation isn't always easy to do or possible. Questioning the validity of different parts of your identity. The smaller pieces of pie, if they got removed, I think I would be okay as long as my faith was there. I like that perspective. That's very interesting. And I say interesting in terms of I've never seen that perspective before, in terms of prioritizing on the bigger slices versus the smaller slices. I really like that perspective. Yeah, invisible identities, questioning self, and if not seen, and feeling offended. Yeah. Okay, we can go back. Oh, thanks. Go back to sharing screen. And I see that someone has raised their hand. If you have a question, please put it into the Q&A chat function feature. Let me just get my ducks in a row really quick. Okay, so now we are going to move into our second activity, which is the social identity mapping. So again, piece of paper, something to write with. And here we're going to identify 1 to 2 social identities And these social identities can be similar to the identities you already identified within your cultural pie. But specifically the social identities I'm asking for are identities that belong to certain groups, such as race, ethnicity, gender, sexual orientation, ability, nationality. And with these 1 to 2 social identities, you're gonna make like a tree out of it. And I'll have an example up in a second just to make it more clear. But you'll have 3 tiers within your little tree. So the first tier is to select your social identity and place it at the top. Your second tier, you're thinking about the events, interpretations, or values that you may hold with this social identity. So considering the question, how do you interpret this social identity through your personal lens? And then tier 3 are the emotions or feelings evoked when you review the above tiers. So this is based on the impact the social identity has had on your life. So here's my example, Native American, and my values or events that I placed in tier 2 have to do with historical trauma and community. And then into tier 3, the feelings that are evoked when I think of Native American and historical trauma are exhaustion and anger. And then the feelings evoked when I think of Native American and community are supportive and grateful. So here are the instructions and examples put together, and I will go ahead and give you probably about 5 minutes to do your 1 to 2 identities, and then we'll move into our reflection questions again. Yes, and thank you for that clarification. You are writing down your 1 to 2 social identities on paper first. And then we'll move into the Padlet reflection questions afterwards. So I'm going to give us about another minute and then we can go ahead and move forward. Okay, so like with the cultural pie activity, we're going to have reflection questions where you have the option to access the Padlet through this QR code or the link that has been placed into the chat. You also, you can, if you feel like you have the time, you can answer all 4 questions. But since I'm going to be giving you only about 5 minutes to respond, responding to 1 to 2 questions that you feel the most strongly connected to is perfectly okay as well. So I'm going to give it a minute so everyone can access, and then I'll have the screen share flipped so we can see everyone responding in real time again. And again, within this Padlet, I just have the example to the left-hand side and then the reflection questions for you to comment on. I'm not sure why this time it's not quite popping up, but
I'm gonna try clicking on this like how I just did. It says there are 6, so I'll just go through them this way and I'll kind of hop back and forth. So sorry if it's a little disorienting for folks. Oops.
yeah, so I think they're still taking the time to respond.
Yeah, okay, I'll just give it a minute and I'll hang out on the main page for another minute.
I'm only seeing a few responses, and I just want to make sure that everyone is able to comment or access this Padlet. Or maybe I'm just impatient.
Claire says she's having trouble typing in it.
Oh, okay. Not user friendly on the phone. If you're not able to answer on the Padlet, you're more than welcome to just go ahead and put your thoughts into the chat.
I'm just gonna try opening one of these and see if it takes me to a totally different. Oh, it just looks the same as before. Okay.
Yeah, and doing it on your own is perfectly okay too without the Padlet. There's no right or wrong way to do this. Okay, so I'm going to go ahead and start with question 1. Reflecting on your map, how do you experience privilege and or marginalization? So being reminded of your privilege, hearing the stories from the kids you work with, and they have experiences that you never had due to culture and ethnicity, lack of resources, and feeling like you don't belong, privilege, constrained roles and opportunity, not many people knowing about historical trauma, so feeling invalidated and frustrating. Reminding yourself that they don't know your story and that you experience many privileges as a white woman and being aware of how you can marginalize others. Marginalized and dehumanized by gatekeeping and not being enough to belong anywhere with this identity. Yes, gatekeeping can be very detrimental, especially if you're not aware that you can be a gatekeeper. Like, that's a privilege in itself. Feeling like some of your privileges can help your areas of marginalization, experiencing privilege in general society based on like complexion and gender, and at the same time experiencing marginalizations within your cultural group for these same aspects of identity. That's very thought-provoking. And then people have a lot of assumptions, which makes it difficult. Okay, thank you for sharing that. We're going to look at question 2 now. So question 2, if you hold social identities that have a mixture of marginalization and privilege, how do you hold space for this within yourself and when you collaborate with other organizations? So understanding that you have partial privilege due to the fact that you are a woman and not being taken seriously, it can be viewed more as an object or even property. Trying to be aware of your surroundings and acknowledge which privileges are dominant in different settings, how it affects those around me. Yeah, being aware of your environmental settings, utilizing feedback from friends and coworkers, understanding from an underserved side how challenging it could be to ask for help and not understood. It is definitely a hard balance to hold. Not feeling, or I don't feel a perceived privilege in hiding my identity is a privilege in mine because it carries erasure, dismissal, gatekeeping from the community. I work to show up and live as my whole authentic self and share my experiences and perspective with others. Since I am a white female, I usually just operate with the stance that I am more privileged than others, despite being female, as I still have it much better compared to many other people. These are great reflections so far. So question 3, what connections do you notice between your cultural pie and social identities? Social identity you chose was also your biggest piece of pie. Did not give gender a piece of the other pie, yet it was your first choice for this exercise. The social identity you chose both provides you frustration and pride. It matched. Being Latina is the core. The social identity I chose was the biggest part of my culture pie. Both are rooted in gender for you because you were raised that it makes up most of who you are, even though you don't feel like this should be as big of a deal or make a portion of how you're viewed by others. Wanting to distance yourself from your social identity and associate more closely with cultural identity. Marginalized social identities make up more of my pie, and that is probably because I have to think about them more as I move through the world. And I see in the chat, even though I am female and white, having many, many years of working with marginalized clients helps me have a better understanding of their challenges. I know that I am always in a learning status. And now we are looking at our last question. So with social identities come biases. How do your social identities influence your potential to become disengaged from a client or colleague? I see it as an opportunity to teach them my culture and the identity through it. It can feel awkward. Sometimes being perceived as less than, not as smart or weak because of gender, ethnicity, and size. Identifying as young female can relate to female clients, but also identifying as young female with no children. So disengagement may occur when we talk about family and children. Yeah, so being very aware of those different experiences that you may hold. Having a hard time engaging with anyone who isn't supportive of my identities. Majority of clients are young mothers. Working to find a balance between engaging in cultural exchanges and brave conversations with allies versus draining my energy engaging with those who may never change versus supporting transformation and growth within my own culture. Yeah, that is definitely a fine line that many people of color, it's like walking a tightrope. I am more prone to be biased against people who are privileged and not aware of them or deny those privileges. Yeah, it does get very frustrating, especially when those power dynamics aren't acknowledged and how that can be detrimental to forming trust within your relationship between a service provider and a survivor. So thank you all for sharing. It was really great. I'm trying to get back to my screen. I apologize. Okay. So I want us to have or grasp the understanding of these connections between the culture pie, the social mapping activity, which is discussing positionality, and the accessible, culturally responsive, trauma-informed approach. And through this self-reflection of privilege and marginalization, it can give us a sense of how we may be putting our biases onto the circumstances of the survivors that we engage with. And this fosters oppressive practices not only at the interpersonal level, but it also influences the institutional level. So by using the ACRTI for cultural humility and equity-based approaches, we are able to identify these oppressive practices and help organizations remove these deficit perceptions, and encourage strengths-based practices to help keep the diverse cultural backgrounds in mind when we engage with survivors of domestic violence and intimate partner violence. So it's important to put these three aspects listed here above within this conversation, because many of our engagements and interactions with survivors does illuminate the power imbalances that can be occurring. And as we move forward into the next section, we will look to confront these power imbalances at the individual and organizational levels, so that we're better effective in how our, for example, organizational policies and our own perceptions may be affecting the outcomes of providing physical and emotional safety to and with survivors. And as service providers, we will always be in a higher power position than survivors who are accessing services from us. So when we are in higher levels of position, we can feel neutrality, whereas the individual that we are working with may feel unsafety or unsafe. And we need to understand how we define our own social norms and how our perspective and privileges affects our ability to create that connection for a sense of safety and belonging within these spaces that the survivors are accessing. So as mentioned, we are going to shift the conversation a bit from individual and culture to individual and organization, still within the context of culture. So by centering the ACRTI approach in this conversation, we're still working to center the voices of survivors that integrate cultural responsiveness to limit the re-traumatization and re-victimization. So this leads to the question of, do our behaviors line up with our intentions? So as stated throughout this webinar, we use self-reflection to identify oppressive practices that can be occurring at the interpersonal and institutional levels in an organization. And self-reflection can only take us so far. So it's important that we sort of take it a step further and identify ways our behaviors could be internalizing these oppressive practices and projecting on the survivors that we work with. So the next step is to determine how organizations can take these self-reflections and determine how to align our behaviors with our intentions, with our personal values and mission statements to foster places of safety and belonging. Now, I want us to recall the social identity map. It helps us understand how we are connected to our personal beliefs and experiences, and the ways that institutional structures and cultural values can influence our interactions based on our positionality in society. And for this particular image, by positionality, what I'm referring to is the political and economic structures that can foster biases. So based on the image in this slide, we can see that the survivors that we are working with are also impacted by social identities and personal beliefs that may or may not align with our own. So again, this highlights the power dynamics that are happening within the service or survivor service provider relationship. Is it power over or is it power with? It's important to understand how our organization can be influencing these power dynamics and how it's integrated with the service provider and survivor relationships. I apologize, that was a lot of S's. So here's the individual work culture connection with the diagram below it. And I want us to look at the first circle on the left-hand side, that's the individuals attracted to the work. And so if we're attracted to the job or career that we're in, it's very likely this can come from personal experiences. And then we have the center circle, which is the organizational culture. And this is where the work is taking place and the types of interactions you have with staff and with clients and the social norms that are present that can be influenced by policy and how that cultural responsiveness is implemented. And then we have the work itself on the right-hand side, which looks at the duties we have as professionals and the services we provide to the populations we interact with. And when these three circles are aligned with each other, this means the staff feel supported, engaged, and feel like they're making a difference. However, when they're not aligned, this can cause shifts in the work environment and cause oppressive practices to come into play at the institutional and interpersonal levels. I found this slide to be important because we need to understand how implementing cultural humility and equity-based approaches isn't just happening at the interpersonal level. It also happens at the institutional level based on the policies that are implemented. So I want us to think about the ways that institutional practices influence our interpersonal practices with survivors and how support can be fostered so that the organizational culture and the work itself hold space for the multitude of cultural experiences among the individuals that we work with. So before we move into our last reflective practice, I just want to stop to see if there are any questions.
No questions in the chat yet, but if you do have a question, just put it in the Q&A or the chat and we'll make sure to get it as we go along.
Thanks. Yeah, so here is our last reflective practice. And again, you can access the Padlet through this QR code or the link that's provided in the chat. Again, if you're having difficulty putting your responses into the Padlet, you're more than welcome to put your responses into the chat. I do ask that we put a focus on question number 3. How can I incorporate cultural responsive approaches in our work at the interpersonal level and at this institutional level? And then you can go ahead and choose one other question that you feel the most connected to. So everyone, please respond to question 3 and then one other question that you would like to respond to. Okay, I'm gonna stop sharing my screen so we can go to that Padlet live.
And I did check this before we got here. So this is set up like the first one, it looks like, so people should have an easier time answering.
Awesome. Thank you so much. All right, I'm gonna look at the responses in question 3. So how can I incorporate cultural responsive approaches in our work at the interpersonal level and/or at the institutional level? And I see a lot of conversation around centering the survivors' experiences, which is great, very great. And how to like initiate the conversations and engaging in your own personal self-reflections regularly. So one agency is split up across different offices. And for institutional, I see conversations about continuing the conversations and checking in with other departments, patient surveys, ongoing trainings, addressing and educating on microaggressions, insensitive and corrective measures, continued advocacy and education. And just an integration of always being respectful with the individuals that you're interacting with. So I'm going to move to question 1. What do I need to learn about, understand, and consider about another's beliefs, values, and experiences before I act? Consider the differences at present between cultural community experiences and individual experiences. Yes, that's very important. Because that can shift how cultural identities are perceived and internalized. Yeah, there are many familial differences within cultural dynamics and within communities too. And asking what's important to people and how can my actions hurt someone based on their beliefs, experiences, or values? Am I hurting or helping? First, do no harm. I try to take that perspective seriously and decide if my actions will be supportive or damaging. What is important to you and what is important for me to understand about you? Yeah. Question 2, what do I need to be curious about? Always remaining curious and not jumping to conclusions. How does your presence affect others around you? Other cultures, individual experiences, and anything outside of your own life? Other people's values, remaining curious about this topic, and learning new techniques, relational culture, everything. Someone put everything. It's with an open mind. Life experiences and attachment styles that can impact cultural identity and belonging. And then in question 4, what do I need to learn about, understand, and consider about another's beliefs, values, and experiences before I act? Oh, that's the same as question 1. Apologies. So to know your own identities and biases, it's extremely important. Practicing cultural humility, respecting beliefs, and understanding the intersections or invisible, unseen identities. Yeah. Thank you so much, everyone, for sharing. So when we respond in culturally resonant, trauma-informed, person-centered, and survivor-defined ways, people feel safer talking about their experiences, are more likely to access our services, and are more likely to find our services helpful. And this is the last slide of my presentation. And I wanted to use this image to further represent the feedback loop that is happening at the interpersonal and institutional levels within organizations. This informs us of how cultural humility, cultural responsiveness, and equity-based approaches can be implemented in the organizational and staff engagement with survivors of domestic violence and intimate partner violence. So the intention for this graph is to help identify oppressive practices and where healing and social change can occur, specifically within that individual work cultural connection, which part of those three circles could be impacted the most. So we have about 8 minutes left. Thank you all for attending today's session. This is my contact information, and I just want to see if anyone has any questions before I go ahead and share the additional resources that I have for you all. So we have a newsletter that you can sign up to. We also have social media platforms on Twitter, Instagram, and Facebook. Yeah, thank you all for attending. So glad that you've enjoyed it.
Thank you so much. That was really an awesome presentation. It's hard to do interactivity in a webinar. So yeah, that was really, really impressive and amazing. And the content was very helpful. Everyone, just a reminder, you're going to be redirected to a very brief survey. We'd really appreciate it if you could fill it out. That's how we report back to our funding agency. We have provided a fact sheet as well as the slides in PDF form in the chat. Those will also be available along with the recording of today's webinar on the Great Lakes MHTTC website as a product in about 2 weeks' time. If anyone has any questions for Tori, she has her contact information at the end of those PowerPoint slides in the PDF that we sent. And also please feel free to reach out to any of us at the Great Lakes MHTTC with any questions after the fact. And you have many thank yous in the chat and also in the Q&A if you didn't have it pulled up.
Yeah, thank you all. And the stuff I'm sharing is also information that you can find on our website. So we have tip sheets, we have toolkits, we have guides. So like I stated in the beginning, we focus on the intersections of domestic violence, mental health, substance use, and trauma. So I am happy to respond to any additional questions that you may have after this webinar has ended. So feel free to go ahead and email me if you would like.
Great, thank you.
Yep. Sorry, Christine. I also put the links to registering for part 3 and 4 in the chat if you would like to go to that. Otherwise, just go to the MHTTC website.
All right. Thank you all again. Have a wonderful rest of your Thursday. Bye, everyone.